small businesses. At a time when many Americans are enduring significant economic challenges, this bill will help small businesses to keep millions of workers on the payroll. You see states are starting to open up now, and it's very exciting to see. I think it's very awe-inspiring. We're coming out of it, and we're coming out of it well. And I'm very happy the governors really have been doing a really good job working with us, and it's really pretty impressive to see. I've spoken to numerous leaders of countries over the last 48 hours, and they are saying we're leading the way. We're really leading the way in so many different ways. I'm also very pleased that Harvard, as you know, Harvard and Stanford and Princeton and numerous other universities and colleges, and also large businesses have sent funds back to us. And in some cases, I stopped funds that I looked at, and we are pleased to report that the funds have either not gone out, or it's about $350 million, and they've either not gone out, or we've renegotiated it, and they're not getting them. So in a couple of cases, they're sending them back immediately. So I think it was very nice. I want to thank Harvard in particular. They acted very quickly and decisively, and they agreed when they heard the facts that they should not be getting it. So we appreciate it very much from Harvard, Princeton, Stanford, and other institutions. The bill also includes $30 billion to support small lending institutions serving distressed communities, helping countless African American and Hispanic American small businesses. As we continue our battle against the virus, the data and facts on the ground suggest that we're making great progress. In 23 states, new cases have declined in the peak week. 40% of American counties have also seen a rapid decline in new cases. 46 states report a drop in patients showing coronavirus-like symptoms. That's a big number. To keep America gaining momentum, every citizen needs to maintain the vigilance, and we all understand that very well. We've gone over it many, many times. This includes practicing good hygiene, maintaining social distance, and the voluntary use of face covering. A safe and phased reopening of our economy. It's very exciting, but it does not mean that we are letting down our guard at all in any way. On the contrary, continued diligence is an essential part of our strategy to get our country back to work, to take our country back. We're winning this, and we're going to win it, and we're going to keep watching. We're going to watch very closely for the invisible enemy. With each passing day, we're learning more and more about this enemy. The scientists at DHS have released a report offering a number of insights about how the virus reacts to different temperatures, climates, and surfaces. The findings confirm that the virus survives better in colder and drier environments and does less well in warmer and more humid environments. I have to say that very excitingly, we're going to have somebody up. Bill will be up in just a little while. It was a great report you gave, and he's going to be talking about how the virus reacts in sunlight. You really hear the numbers, you won't even believe them. U.S. trials of the COVID-19 have been going on and have been approved in the United States, Germany, UK, and China. That's big news. And a lot of trials are going on. We have a lot of great, brilliant minds working on this, both from the standpoint of vaccine and therapeutics. We must be careful in all conditions, but we will get this done. We're very close to a vaccine. Unfortunately, we're not very close to testing, because when the testing starts, it takes a period of time, but we'll get it done. And I want to thank the head of DHS Science and Technology, Bill Bryan, for what he's going to be doing and what he's going to be saying, and the report that he's about to give. I think it's going to be something that nobody's ever heard. It'll be brand new information and very important information. My administration continues to leverage the Defense Production Act to dramatically increase the manufacture and delivery of critical medical supplies. We finalized 3 contracts to produce 39 million more N95 masks in 90 days. And as you know, we're also using a sterilization process, some great equipment that will sterilize the masks up to 20 times per mask. So that's like ordering 20 times more masks. and it's working very well. We just want the hospitals and the institutions where it is to use it. A lot of people don't use it. They're so used to getting a new mask, they don't want to use it. They want to go and immediately get a new one. We're asking them to use the sterilization process. Every bit as good, up to 20 times, think of that. In addition to ramping up our domestic assembly lines, we also have airlifted nearly 750 million pieces of personal protective equipment into the United States through our Project Airbridge, which has been an incredible thing to watch. It's really a military operation. The Vice President is now providing each governor with an exhaustive count-by-county breakdown of the privately distributed personal protection, and this is equipment and things that are incredible. It's personal protective equipment. It's incredible, and it's all brand new and at the highest level. We're getting only the highest level. And also we're looking at essential gear within their states, and it's being delivered to different states quickly and as we speak. This way the governors should know exactly what's being delivered through a private sector supply chain within their states, as well as through the Project Airbridge. We're trying to get it immediately from the plane to the state. When we can't do that, we bring it into our facilities and get it to the governors. And we're getting them fast, and we're notifying them very strongly so they know it's there. Governors can use this information to quickly ensure that they get materials where and when they are needed. Today, I also want to extend my special thanks to our nation's incredible county emergency management teams who have been working relentlessly for weeks around the clock, end on end, to serve their communities, help distribute critical supplies, and save countless American lives. We salute these heroic officials on the front lines. As we continue to develop potential therapies, the FDA has recently begun a national effort to expand access to convalescent plasma donated from the blood of those who have recovered from the virus. The blood of these donors contains antibodies that can potentially reduce the severity of the illness in those who are sick, and frankly, those that are very sick. Nearly 3,000 patients are now enrolled in the Expanded Access Program, receiving transfusions nationwide. And I want to thank all of the people that recovered for what they've done. They, as I said yesterday, they raise their hand when they barely can walk, and they're saying, I want to donate blood, I want to donate whatever it is that you want, because we want to help people. It's really quite incredible. Convalescent plasma will also be used to manufacture a concentrated antibody treatment that does not have to be matched with a particular blood type. This concentrated antibody treatment could be used as a preventative measure to keep healthcare workers and other high-risk populations from contracting the virus in the first place. Very big deal. Clinical trials of these products are slated to begin within weeks, and we can maybe have a fairly quick solution. I urge Americans to get in there and keep doing what you're doing, because, again, we want those people recovering or recovered from coronavirus to contact their local blood and plasma donation center to learn how they can help. And they've been so great, and I just appreciate it. My administration has also partnered with and we have really been establishing some great partnerships with leading technology companies and scientific journals to create a database of 52,000 scholarly articles on the virus that can be analyzed by artificial intelligence. Top AI experts are now using this wealth of data to gain insights into potential therapies. And we're collaborating with tech firms, universities, and our national labs to harness American supercomputers in the search for treatments and vaccines. That search is going on, and it's being, I think you'll see in the future, you'll see it's very successful. Ultimately, it'll be a tremendous success. Great progress is being made at a rapid pace, a pace like no other. We have every hope that with the full might and resources of American science and technology, and with the courage and devotion of the American people who have been so incredible, we will end this plague, and together we will restore the full measure of American strength and power and prosperity. Our country is going to do fantastically well. You see what's going on. There is a pent-up demand in our country to get it back right where it was, and maybe even better, and that's what's going to happen. So with that, I'd like to ask Mike Pence to come up. Vice President, say a few words, please, Mike.
Thank you, Mr. President, and good afternoon. Today, the White House Coronavirus Task Force met, and while our hearts are with the families of those who have lost their life to the coronavirus and those who are struggling with serious illness today, our team, led by Dr. Deborah Birx, informs us that the data continues to show promising signs of progress. The New York metro area, New Jersey, Connecticut, Detroit, and New Orleans all appear to be past their peak, and we are seeing consistent declines in hospitalization and cases in regions across the country. Our only conclusion is that we're getting there, America, because the American people have put into practice the President's guidelines of social distancing, because you've been listening and adhering to the guidance of state and local officials. We're making meaningful progress, in a very real sense, sparing Americans to be exposed to the coronavirus, and in no less extent, saving lives. Our task force actually believes, Mr. President, that if we continue these mitigation efforts in the days ahead, as states implement their policies, including phased reopening that will preserve those gains, we do believe by early summer we could be in a much better place as a nation with much of this coronavirus epidemic behind us. Earlier today, we also had a conference call led by Secretary Ben Carson and leaders from HUD about the President's announcement yesterday that he is repurposing the White House Opportunity and Revitalization Council to focus on the impact of the coronavirus on minority communities. Secretary Carson will convene the council tomorrow and will be reporting tomorrow afternoon on their progress. We want to thank the more than 270 leaders of organizations dedicated to housing, homelessness, and improving the lives of people across our urban communities, not only for being with us today, for the way they have partnered with our administration and partnered with state and local officials to put the health of all of their constituencies first. As the President mentioned, you'll receive a report that our task force received formally this week from Bill Bryant of the Science and Technology Directorate at the Department of Homeland Security. He will outline, as the President said, encouraging news about the impact that heat and sunlight have on the coronavirus, which will increase the confidence that we feel about the coming summer. On the subject of testing, at the present moment, we have reports of 4.93 million tests having been performed across America, and encouraging news as states have been engaging commercial labs at a higher level across the country. Yesterday, our commercial lab system did more than 100,000 tests in a single day. So we're beginning to activate all of the capacity. And tomorrow, at the President's direction, our task force will convene a conference call with all of the nation's governors to talk about their progress that they are making on testing. And we're going to hear from governors about the practices and methods that they are employing to significantly increase testing following our briefing about capacity in laboratories this past Monday. For instance, Governor Mike DeWine just announced that Ohio's testing has been greatly expanded after the FDA approved Thermo Fisher's new extraction reagent, saying in his words that the action, quote, probably doubled, maybe even tripled testing in Ohio virtually overnight. Governor Tim Walz of Minnesota announced, along with the state's healthcare system, the Mayo Clinic, and the University of Minnesota, what he described as a breakthrough for rapid, widespread testing, able to test more than 20,000 people using a molecular test per day. Governor Kim Reynolds of Iowa launched the Test Iowa initiative that will triple testing capacity by partnering with Nomi Health and Domo. She also worked with the University of Iowa hospitals to leverage further capacity. And Governor Eric Holcomb and Governor Andy Beshear of Indiana and Kentucky, respectively, both announced additional drive-through testing locations. Our priority has always been to focus first on those impacted by the coronavirus and then on those extraordinary healthcare workers ministering to their needs every day. And I know, Mr. President, how proud you are